Hello, I'm Dr. Ava McLaughlin, and I'm so excited to be talking to you about the KCH Weight Management Program and to discuss with you all the great things that we're offering at Knox Community Hospital. I am so glad that you're here today taking the first step. I know it is so difficult to start this journey, but we have a fantastic team that are here to help you every step of the way. During the seminar, you will hear about the different pathways that we offer to determine what makes sense for you and your goals. You will meet our wonderful team, and finally, I'll talk to you about the different surgeries that I offer if that is something you're interested in.
Hi, I'm Amy Farrenball. I am the nurse practitioner for the KCH Weight Management Program. I will be the provider that you will meet at your initial consult, and I will be helping guide you through whichever pathway you choose in the program. So let's discuss the optional pathways throughout the program, and we'll discuss this a little bit further in detail when you come in for your initial appointment. The first pathway that we have is the medical pathway. The medical pathway is for patients who do not qualify for weight loss surgery or do not desire weight loss surgery. We have a few treatment options in this pathway. The first is that you will be seeing me monthly, at least to start, and I will also be referring you to our bariatric dietitian that you will meet next. We also will offer you the opportunity to participate in our Healthy Habits program. This enlists the help of our wellness coaches and our exercise physiologist and helps with the mental and the physical activity piece of weight loss treatment. I also may be ordering some lab work for you to determine if you have any other potential causes for weight gain that we can treat, and possibly using medications for weight loss depending on your past medical history. The second pathway in the program is the surgical pathway. As the name implies, this pathway is for patients who do want bariatric surgery or weight loss surgery and do qualify for weight loss surgery. For the most part, you'll start out very much like the medical pathway, but with a few additional requirements based on your insurance and our program's requirements. We do encourage you to reach out to your insurance to check on these benefits, but we will also look into these prior to your appointment, and we'll discuss those further at your appointment as well. In addition to completing the medical pathway, you will also meet our sleep physician and a psychologist, and possibly a cardiologist, which is a heart specialist, or a pulmonologist, which is a lung specialist. It's important to note that throughout the program, patients do flip back and forth between pathways, and that's okay. Things change. We realize that, and this program is going to be very individualized to your needs. While this may seem very overwhelming right now, we want to ensure you that we will be there to help you throughout the way. Our entire team is looking forward to helping you get to a healthier you.
Hi, my name is Natalie Brenneman, and I am the bariatric dietitian in our weight management program. At our initial appointment, my goal is to get to know you, to find out your eating styles and food preferences, and find areas that we can make improvements. No matter what path you're on, I recommend that everyone track the things that they're eating. This can be done on free apps such as MyFitnessPal or with pen and paper, and the goal is to increase awareness of the things that you're eating throughout the day. I recommend that everyone take advantage of our free monthly support groups. This is a way to get hands-on education, and we feature topics such as protein supplement tastings, grocery store tours, and recipe makeovers, and find ways that you can implement these changes during the process.
Hello and welcome to Connections Fitness, where Healthy Habits takes place. I'm Rachel.
And I'm Cassie.
And we will be your wellness coaches through the program.
As wellness coaches, we'll work with you from day one until the end of the program, helping you make goals and find those barriers that might hinder you from reaching those goals, and figure out ways to work through them by brainstorming, so that way you can accomplish those goals by the end of the program.
Things that are included in the Healthy Habits program are: you get access to the fitness center, you get access to all of the classes that we offer, and you get access to the support groups. At the beginning of the program, you will meet with an exercise physiologist to do an initial consultation. In this consultation, you will do an in-body screen, which breaks down muscle mass, fat mass, water index, BMI, and you'll also do a graded exercise test.
Depending on which route you choose, either the surgical or non-surgical route, the surgical will be 8 weeks prior to surgery, and then we'll meet with you 4 weeks after surgery. The non-surgical route will just go through the program 12 weeks straight.
I hope you've learned a bit about our program and what we offer. I would like to talk to you about the different surgeries that are offered here at Knox Community Hospital. Again, I'm Dr. Ava McLaughlin, and I'm a fellowship-trained weight loss surgeon. Weight loss surgery, or also known as bariatric surgery, is an extremely effective tool that can help you lose weight and keep it off. The first surgery I'm going to talk to you about is the Roux-en-Y gastric bypass. To create the gastric bypass, I make a small stomach pouch that's about the size of an egg. Your intestines are brought up and connected to that pouch. Now, your stomach is left in place, but food bypasses the stomach and the first part of the small intestine. This surgery works in 3 different ways. The first way is it's restrictive. That pouch is much smaller than your normal stomach, so you're not able to eat as much at one time. The second way is malabsorptive. Because the food doesn't go through the stomach like it would normally do, not all of the calories and different things that you take in are actually absorbed by the body. The third way is hormonal. Again, because it's bypassing that stomach, a lot of those hunger hormones that you hear about aren't activated, and this helps you feel full and helps you with your weight loss journey. Some of the pros for the Roux-en-Y gastric bypass is that the weight loss is exceptional. Typically, my goal for a patient who's undergoing a Roux-en-Y gastric bypass would be about 80% of their excess body weight. There's also better resolution of some of the comorbidities such as diabetes. I also want to talk about some of the long-term possible side effects or cons of the surgery, which might help determine what surgery is right for you based on your medical history. Since the Roux-en-Y gastric bypass changes your absorption, this can lead to dumping syndrome and also to a change in absorption of certain important medication. It's important to avoid the use of tobacco and alcohol lifelong, as with the Roux-en-Y gastric bypass, it can lead to quite serious complications if these are continued. It can also have a risk of an internal hernia, so it's important for you to know about these things if this is something that you're going to consider. Next, I would like to talk about the sleeve gastrectomy. For the sleeve gastrectomy, your stomach is taken from about the size of a football to the size of a small banana. This is created by using a sizing tube and dividing the portion of your stomach. The sleeve gastrectomy works in 2 ways. So the first part is restrictive. It limits how much you can eat at one time. And the second is hormonal. The portion of the stomach that is removed has a lot of those different hunger hormones that aren't activated since it's no longer there. Some of the reasons people choose the sleeve gastrectomy is because there are typically less issues with malabsorption, and it also has great weight loss. One of the things that we always worry about with the sleeve gastrectomy is new or worsening reflux. For people who have serious reflux, then I would recommend considering the Roux-en-Y gastric bypass, as that can help decrease reflux. But this is something that we can talk about in the office.
Hi, my name is Ashley, and I am the coordinator of the weight management program at Knox Community Hospital. Thank you for taking the first step in viewing our online seminar. Each patient's journey is different, and here at Knox Community Hospital, we would like to take the steps in making sure that we personalize each patient's journey. Also, I would like to tell you a story and about how I got to be in this position. I am also a weight loss surgery patient. Weight loss surgery has dramatically changed my life, leading me to a happier, healthier person. I took this role wanting to help change other people's life how my life has been changed. I am now a happier, healthier person, and I also am now able to work with those that help me change my life.